Assalamu alaikum. My name is Maryam Abid and I am the student of Final Prof Morning, and the drug which I am going to describe about is Diloxanide. Introduction. Diloxanide is a medication used to treat amoeba infections in places where infections are not common. It is a second line treatment after paromomycin, which is an antibacterial, and it is taken orally. It is a dichloroacetamide derivative that is a luminally active agent used to eradicate cysts of E. histolytica. The rational use of Diloxanide is luminal amebicide, works in digestive tract only, second line treatment for infection with amoebas, and used in combination with metronidazole to treat amoebic dysentery and diarrhea. Side effects. The side effects include, its side effects basically are, it often causes flatulence and occasionally nausea, vomiting, diarrhea, and urticaria and pruritus. The drug-to-drug interactions of Diloxanide are, there are no such drug-to-drug interactions with Diloxanide, and they are not reported up till now. So if you feel any symptom of interaction, any type of drug-to-drug interaction, so it's better if you consult with your physician and report him. Moreover, there is no such food interaction also found about this, so it can easily be taken with food before and after having the food. And also the other indications and the other interactions include that it should not be taken with alcohol. Toxicity. The overdose of Diloxanide can cause toxicity, and these includes nausea, the vomiting, diarrhea, abdominal cramps, flatulence, skin rash, itching, headache, and dizziness. Antidote. There is not an exact or single drug that acts as an antidote of Diloxanide, because normally Diloxanide is 90% available with the minimal chances of toxicity, and it is usually not toxic in most cases. So generally it doesn't have a proper single antidote, but if its overdose occurs and it leads to toxicity, then we will go for following drugs to treat it. Number one is the chlorpheniramine, is an antihistamine which treats itchy skin and rash. And then we have corticosteroid cream. We can also apply topically to treat the skin rash and itchy condition. And thirdly, we have the bismuth subsalicyclate, is a drug which we can use to treat diarrhea, nausea, vomiting, and abdominal cramps caused by Diloxanide toxicity. But most importantly, we can use these drugs, but it's preferable to consult with your physician before taking these. Irrational use. Diloxanide furate. The diloxanide furate is its another name. So it is used mainly and only to treat amoebic infections throughout the whole digestive tract. It does not have any other use in any other critical situation. It treats only amoebic infections related to GIT. So its irrational use has not been reported up till now. Alternative choices for Diloxanide includes metronidazole firstly, and then paromomycin if metronidazole doesn't affect well. The alternative brands with high and low prices are Flagyl Plus and MD. They are of high price drugs, and low price drugs includes Medial and Oxazole. Diloxanide's available dosage forms and preferences. It is mainly available in tablets form. Adult dose includes 500 mg every 8 hourly for 10 days, and children dose includes 20 mg per kg per day thrice a day for 10 days, right? It is also administered in suspension form. Dose include 125 mg per 5 ml. Suspension form is basically recommended for children, because it is convenient for children to take the suspension form of the drug as compared to the tablet form. And thirdly, also available in parenteral form but not preferred and recommended to administer because diloxanide can cause allergic reactions if given parenterally. Now we will look for the case study related to diloxanide, which shows a 64-year-old Caucasian heterosexual male restaurateur living on the Cape York Peninsula presented with a 3-day history of right iliac fossa pain. He had traveled to New Zealand 1 year previously and to North America 6 years earlier. A CT scan revealed extensive inflammatory standing around the appendix and 2 small collections. Laparoscopically, a cecal mass was identified, which was thought to be a neoplasm, and so a right hemicolectomy was performed. Histologically, the cecal mucosa was ulcerated with an abscess extending into the serosa. There was chronic inflammation with prominent eosinophils and numerous amoebic organisms with ingested erythrocytes. On examination, following data is collected, which is given below, and we will look for it in detail in the form of SOAP notes. Now, SOAP notes. Subjective. The chief complaint is the pain in the right lower abdomen, and which is basically the pain in the right iliac fossa. But the patient is right iliac fossa is not the one. Patient was telling that pain is in the right lower abdomen. Then medical history, none. History, occasionally alcoholic. Current medication, also none, because as apparently he appears to be healthy. And allergies, no such allergies are reported also. Then objective. Vital signs include the blood pressure is 140 by 75, which is quite normal, and temperature is 38, which is also normal. Pulse is also normal, 98, and respiratory rate is also normal, because normally the respiratory rate is up to 15 to 20 breaths per minute, and in elderly people, so it's normal. Laboratory data is WBC count is given, which is normal. Hemoglobin is normal. Chest X-ray is also normal. CT scan results shows extensive inflammatory stanting around the appendix and 2 small collections. Laparoscopic results shows a cecal mass was identified, thought to be a neoplasm. Histological results of cecal mass. Cecal mucosa was ulcerated with an abscess extending into the serosa, and chronic inflammation with prominent eosinophils and numerous amoebic organisms with ingested erythrocytes is also seen. Now assessment. Differential diagnosis. There could be appendicitis. There could be a chance of appendicitis because but this thought is excluded because CT scan showed inflammation around the appendix but not within the appendix. Appendicitis is basically the inflammation of the appendix, but here the pain and inflammation is around the appendix, not within the appendix or in the appendix, right? So it is not appendicitis. Secondly, it could be benign or malignant cancer because of cecal mass showing thought to be as neoplasm, which shows the new growth of the cells. But hemicolectomy showed no chances of cancer. Rather, the cecal mucosa was ulcerated and occupied by many amoebas. So there we found the presence of amoebas, and there is not the outgrowth or any additional growth there. So it's not the chance of cancer also. So the main diagnosis is the old restaurateur has right iliac fossa pain, and the cecal mass of abdomen reveals that it is ulcerated with an abscess extending into the serosa, and also has chronic inflammation with prominent eosinophils and numerous amoebic organisms with ingested erythrocytes. These findings shows that the patient is suffering from asymptomatic amoebiasis and an amoeba was diagnosed. Now plan include the pharmacological management is diloxanide furate is recommended 500 mg every 8 hourly for 10 days, and it is recommended along with the metronidazole, which is given 250 mg per oral thrice a day for 6 days. The patient recovered at 10th day. And non-pharmacological management include water must be boiled before it is safe to drink. Raw vegetables must be washed with soap and then soaked in vinegar for 15 minutes before they can be eaten. And since amoebiasis often spreads through a household, it is prudent to screen family members of an index case for intestinal E. histolytica infection. These are the related references. regarding the information which I have given in the Diloxanide PPT. The end. Thank you.